to my computer. Everybody will get that little agreement. Alrighty, well, hello everybody. Thank you so much for joining us today for our April Lunch and Learn. We are here with Miss Danielle Foster, who is just the kindest, nicest, most wonderful person, and she's going to speak with us today about perinatal mental health and an array of different ways in which resources abide in our community, things to talk about, go through all the background for all different levels of understanding of the subject. I'm going to do a brief introduction and then hand over the mic. So a little bit about Danielle. Danielle is a dedicated advocate for women's mental health with a passion for guiding women through life's challenges. As a licensed clinical social worker in Florida, she specializes in maternal mental health, anxiety, depression, life transitions, self-esteem, loss and grief, perinatal loss, and relationship issues. With nearly 3 decades of experience in group facilitation, mentoring, speaking, community outreach, training, program development, and nonprofit work, Danielle has made it her mission to provide compassionate support to women, especially mothers. She has extensively studied prenatal and postpartum depression, anxiety, and trauma, recognizing the unique struggles mothers face. Danielle is trained by Postpartum Support International and is listed among their trained providers in the area. She also facilitates an in-person support group twice a month for mothers struggling with perinatal mood and anxiety disorders, a group she founded in October 2020 that continues to serve women today and for many years to come. Committed to dismantling the stigma surrounding maternal mental health, Danielle challenges the unrealistic myth of the perfect mother. She believes that every mother deserves a safe, non-judgmental space to be heard, understood, and supported. Through education and validation, she empowers women to challenge societal pressures and embrace their own journeys through motherhood. Danielle earned her undergraduate in communications from Salisbury University and her master's in social work from Florida State University. In addition to her full-time practice, she is also an adjunct professor at FSU's College of Social Work, where she helps shape the next generation of social workers. Today, she continues to uplift, educate, and advocate for women as they navigate life's transitions, offering knowledge, guidance, and unwavering support. Danielle, thank you so much for your time, and we look forward to learning from you.
Thank you so much, Abigail. Thank you, Chris. Thank you, everyone, for spending your valuable time here today. I'll do my best to answer questions and share. And I think it's also, and thank you so much for the introduction. I want to also include a couple of other things, and that is that I'm a mom. And I'm looking through the lens of being a mom as well. As I was sharing with Abigail and Chris, my husband and I are parents to a son who will be approaching 21 this year. So probably one of the most important roles I've ever had in my entire life. So for all of us out there who are expectant moms, who are loving on moms, who have moms in their life, or who are considering it, I am with you. So just wanted to toss that out. I do want to get started and just dig a little bit further. Before we do that, though, this quote has always resonated with me. It's an indigenous proverb, and I thought it important to start our time together with it. And what this quote and this statement means to me and those that I serve and those that I work with is that the woman, the mom, the mother is at the center, and that if the mom is doing well, so too is that of her family, her friends, her community, and society as a whole. And looking at a mom even a little bit more deeper, there are so many parts to each of us. Hopefully you all agree. It's the physical, the mental, the emotional, and the spiritual. So it's always a nice way to start with that as a reminder. I see the mom in the center. And maybe it's because I'm a mom as well and a provider. That being said, just to give us a little bit of structure for our time, an overview of what we'll be talking about very briefly today, because we don't have a lot of time. But looking at definitions and terminology, how those have changed within the perinatal world, and adjustment to motherhood. What does that mean? What does it sound like? What has unfolded, particularly in the last 20 years? And what are those societal expectations Also, looking at myths. So, we'll be doing a little bit of myth busting, as they say. And what are the assumptions that are out there that are contributing to negativity for moms or expectant moms? Understanding too, what are the baby blues? So many more people know what the baby blues are now, thankfully. I can certainly attest and say that it wasn't discussed with me 21 plus years ago. So we've really grown in our understanding. But also, too, what's the difference between baby blues and perinatal depression and anxiety? Those two coexist. Pardon me, I have allergies, so I'm going to have to drink a little bit of water in between our time. And then looking at the risk factors and the symptoms and resources. So that's going to give us the parameters for our time today. First, let's look at terminology. So oftentimes we've heard individuals say postpartum or postpartum depression, and that's not inaccurate. However, we have a more general term, meaning a more all-encompassing term referred to as perinatal. So perinatal, it could be perinatal depression, perinatal anxiety. That is referring to pregnancy or the first year after giving birth. So the prenatal pregnancy, and again, postpartum, something that many of us are probably much more familiar with hearing. Again, perinatal is more encompassing of the various mood and anxiety disorders that a mom could potentially experience during pregnancy or post-pregnancy. We're not going to get into every single one of those mood experiences and disorders or illnesses today, again, due to limited time. So again, just to give us a little bit deeper understanding of the scope of the terminology. I think before we go a little bit further, that it's important to recognize that motherhood is a transition. I felt like this image did a beautiful job because there are so many differences in the trees, so many different colors. We as mothers, when we step into motherhood, it is one of really the most significant life changes that we will experience. And reminding ourselves to breathe, whether we are expecting our first child, our third, our fourth, or even contemplating or supporting a mom. But that idea of motherhood and really parenthood, it's a huge transition and an important one. So, stepping in a little bit further, when we talk about the adjustment to motherhood, there are these key areas that I hear from moms that I work with all the time, not just moms in my private practice, but when I speak to women's groups. There's this discussion about how our identity changes. That's big. So you're still you at the core. However, the identity of what you do and what you step into changes. It's no longer just about you and what you're doing in your daily life. You're adding another role, which is the second point, the role of parent. And a beautiful, wonderful one, and also a challenging one at the same time. So there's a shift in the role that we take on. Something that moms also discuss with me a lot is it's a deeper understanding once they're in it of a loss of independence. And when I use the word loss, sometimes moms will kind of throw their hands up and say, well, what do you mean I'm losing my independence? It's a different way. It's different in defining your independence. You're now sharing. I think that's a great word to use. We are now sharing what we do in our lives and our daily activities. But the reality is that it's a lot harder to run out when you have a baby, right? If you can recall, prior to having a child, oftentimes we were used to just throwing a bag in the car and running to the store. There's a little bit more prep time. That's on a small scale, but there's a different way of defining independence. Another issue that we've just started discussing openly, and I'm grateful for that, in the circles in the realm of motherhood is it's the grief, the loss, if you will, of that old role. There is a grieving process that comes with stepping out of just being for myself and caring for a sweet little one. So it's all right to acknowledge that grief. It doesn't mean you want to stay stuck in it. And it's also okay to say, I'm grieving what was and I'm loving what is. That and is so important. It's not necessarily an or, but an and. And self-esteem. Self-esteem and body image, again, oftentimes there's an expectation that our bodies will go back to exactly how they were after having a child. And honestly, our bodies change because it's gone through a huge transformation. And again, that's another and. It's a wonderful experience. However, there are also changes that come with that. And recognizing those from the beginning and are very helpful. Self-esteem is something that can often be impacted. What we found, particularly in the last 10 years from studies, is that a mom's self-esteem can be impacted based on societal expectations. Um, what we see in the media, what we hear from our friends, from our families of origin, or otherwise what we call our FOO in the world of therapy. Um, what are the messages that a mom is hearing, and how is that impacting her self-esteem? And is it realistic? We are all different in how we experience coming into motherhood, and knowing that it's okay to be ourselves and be our unique, beautiful selves is incredibly important as well. But self-esteem and body image is a huge topic that comes up in discussions with moms, and understanding and recognizing that it's going to take a bit of time. I've heard physicians and providers, much like myself, that have said, give ourselves a year for our bodies to reclaim, if you will, itself and to step into this new space that we have. Societal expectations, which I mentioned, they're the cultural norms. Again, back to expectations. I cannot tell you how many times I have heard a woman say that she needs to be perfect, or she thinks that she needs to be completely perfect as a mom. Let me tell you, both as a provider, as someone trained, and also as a mom myself, there is no such thing as perfect. We are all going to make those mistakes and errors. And for us to believe that we have to be 100% selfless all the time is quite unrealistic. If we don't have ourselves filled just enough, it's very hard to give out to others. The pressure to bounce back, as I mentioned in the previous slide, these societal portrayals that we see that we are often bombarded by, expect us to quickly return to our pre-pregnancy shape, and that is unrealistic. Um, Oftentimes, when moms will ask me, they'll say, "Well, Danielle, what do I do to remove this pressure?" And I encourage limiting social media. And then the next follow-up question is, "Well, that sounds really easy, in theory, but how do I really do it, Danielle?" I say set a timer. Set a timer. Really, give ourselves the task. If it has to be coordinated in that effort, set a timer and say, I'm going to spend 10 minutes on social media, and I'm actually going to eliminate certain sites or individuals because it's just not helping me. I want to add on to that, that paying attention to how it feels in our body when we're feeling that pressure from society, those external pressures outside of ourselves, asking yourself, what do I feel like after I've just spent time absorbing and learning about what others' experiences are? Where do I feel it in my body? Do I feel pressure in my heart? Do I feel as if I can't breathe? Do I feel as if, do I feel worse about myself after I step off of those experiences? Those are huge indicators, paying attention to our body. Um, that pressure, we don't need to add more pressure. And the impact on our mental health, which ties very much into that previous point, is the expectations, the unrealistic expectations often worsen our feeling about ourselves, and it can contribute to isolation. And we know that that can also lead into worry and anxiety. So, knowing and sharing space and talking honestly and openly with other moms, which I'll talk about a little bit more on this next in the future slides. This leads me to motherhood myths. I talk a lot about this in the support group that I do, which is the circle of support. And I have a slide for that so that you can snag that information at the end. I bolded certain words just to emphasize how we can step into all or nothing thinking, which is a cognitive distortion. Again, I recognize that we can't go into Aaron Beck's 13 cognitive distortions today. However, tying into that, thinking all new moms should bond with their baby immediately. Instantly is another word that I probably should have bolded here. As it was explained to me, and I have carried this forward time and time again, we are meeting a new person for the first time. We have carried them within us, we have carried them in our bodies. However, we're meeting them for the first time. We are going to need to learn what they're about, just like they're learning what we're about. So to think that we should instantly, immediately, right out of the gate, bond with a baby, that type of expectation on a mom is too much. Each of us are different in how we bond with our baby. Bonding does occur. If we're struggling with bonding, we can talk about that, right? However, to think that instantly, right after giving birth, it should be immediate, that is a misconception. And the more that we talk honestly about that and share that, the more pressure we're going to take off of moms and reduce and mitigate that pressure. It doesn't mean that we don't love our babies. That's not what I'm saying. So please don't confuse that. I think about it like this. We're meeting someone for the first time, this precious child. And so we get to know them. And there are lots of hiccups that come with getting to know them for sure. Thinking that mom should enjoy every aspect of motherhood and parenting, again, it's every or all. We are going to enjoy so much, but there are things that we're not going to enjoy. Um, I often wish that I had kept a journal, but really, who has time to keep a journal when you're a new mom, right? Um, However, I wish that I could think back to all of the things that were just overwhelmingly joyful, and then those things that were really hard, um, that were really difficult. Because again, we're learning a new role, back to the word role that I mentioned a few slides back. Um, Being gentle with ourselves, I think, is some of the best piece of wisdom I was ever given, and I often share with moms that I work with. Good moms always put their children first and don't acknowledge their own needs. Yes, an infant is very needy and they need us as they should. However, if we continue to push ourselves to the side and feel as if we don't deserve attention and time, it will impact us greatly mentally, emotionally, and physically. Often moms will say that I just feel like for the next several years that I can't make anything about me. And I often respond and say, it's not just about making it all about you or making it all about the children, but again, going back to that word share. The French word for share is partage. I have a magnet on my refrigerator. It's a heart in the shape of a heart and it has the word partage on it. It's a constant reminder daily that it's a sharing experience, right? And if we are filling ourselves and taking care of our own needs, we're going to have a lot more to give out to our little ones, to our families, to our partners, to our community. The next point, again, I have the word should bolded. Motherhood should come easily and naturally. We are being placed into a role for the first time, or the second, or the third. And each child will be different. Each experience will be different. So I'm not sure the word easily should be used with motherhood right next to the term motherhood. I think we learn as we go. We can read, we can absorb, we can listen to podcasts, we can attend lunch and learns as often as we wish. And that is incredibly beneficial and useful. However, we're also learning how it works for us, and that's okay. Moms should be able to do everything all themselves. We are not meant to do this alone. Everyone who is listening and taking part today, community matters, whether that community is blood or not. Finding community and knowing that we can lean in and lean on others matters. We are not meant to do it all alone. What I've found and what studies have shown us time and time again is that if a mom believes that she has to do everything. That type of isolation, that type of pressure can certainly contribute to depressive episodes and anxiety, and even additional illnesses within the motherhood realm. We are not meant to do it all. We are not. And how I wish someone would have told me that back in 2004. So I'm hoping that my imparting this to each of you, it will sink in and land on your hearts and also in your brains. Shifting to baby blues, again, I am so pleased that we are more aware as a society here in the United States and beyond about baby blues. But just to highlight a couple of points, and this is important, baby blues is not a disorder. It is not a mental illness. It's an experience. And it's an experience that about 80 to 85% now of moms, new moms, experience universally. And it's this rapid mood changes. We're extremely joyful, we're extremely tearful, and we experience it within up to the first few weeks. So the first few days, first few hours, up to the first few weeks, that time frame is very common. I want you to know if you're a new mom or you're a mom to be, or if you're in that stage, that there are things, and we'll talk about what that looks like in a moment, but 80 to 85%. That means a lot of moms, almost all of us, are experiencing this. Again, as I noted, the onset's typically the first few weeks after birth. I would say the first few hours or first few days, you'll start to recognize this. And we want to give some credit, due credit to our hormones. If you think about the fluctuation of hormones, both estrogen and progesterone, think about it for a moment. There's a significant drop after delivering. And then that in combination with the acute sleep deprivation is going to impact us tremendously. So again, baby blues, something important to remember both for partners, both for moms who are maybe in this place of the first 2 weeks, or if you're pregnant. If you are not yourself and these symptoms, you're having these experiences after 2 weeks, it's likely not the baby blues. And the good news is there's support for that. So moving to the next slide, the baby blues symptoms, moodiness, I'm really tired and I'm angry at the dog, right? And then the next minute we're overjoyed. The weepiness, the intermittent tearfulness, very important. Reduced concentration. So think about this for a moment. We are sleep deprived, right? Because our baby likely is sleeping every 2 to 3 hours, waking up every 2 to 3 hours. So we're exhausted. We're feeling overwhelmed with our new role. That's very normal to feel overwhelmed. We're stepping into a brand new position, as I like to call. We also are questioning our parenting abilities. Many moms have said, and partners as well have said, well, goodness, Danielle, we've read everything we could get our hands on. We've listened to every podcast. We've gone to the hospital and we've attended all of the wonderful tours, and we've learned as much as we possibly can learn. And I always applaud and commend every individual for doing that. That's tremendous. However, your baby is going to have his or her their own unique style. And so, if we're used to things going really smoothly and being able to control every single outcome, this will likely be the first time that we have an experience that we're not going to be able to do that. And I smile doing that, but I can tell you during the throes myself that I was likely not smiling because as a recovering perfectionist, I'll say, I thought that I would be able to control every single outcome and be able to anticipate. And when I couldn't, I questioned. But what I learned from other moms, what I learned from those in my circle, again, back to community, how important community is, that we're going to make mistakes and we're going to adapt and we're going to learn what our baby needs the more that we get to know our baby. Again, back to the other point, we're learning a new human, we're learning a new person. What also to something to keep in mind with baby blues is predominantly the mom is usually happy. Most for the most part, that core person is still there and the self-esteem remains as well. So again, baby blues, quite universal. And I did want to, I don't have a slide for this, but I think it's very important to note that we now know, specifically after the last 6, 7 years of studies, that partners, dads, partners, that are supporting that mom can also experience these same symptoms. What we do know is that some of these symptoms can occur after the first 2 weeks, and we can talk about that when we get to perinatal depression a little bit more. But it's very common for partners to be experiencing this because they themselves are also experiencing change and a new role and a transition. So, partners out there, I see you and I hear you. Um, Shifting to, well, what do I do? Often moms and partners will say, well, what do I do, Danielle, about the baby blues? Time, again, we want to get to that 2 week time frame and then reassess and reevaluate, getting as much sleep as you can. So I say this and I pause because you are doing the best you can with sleep. Moms will sometimes look at me when I will ask, well, tell me about your sleep. And they'll say, Danielle, if one more person asks me about my sleep, I'm going to throw like this pillow or I'm going to do something. That's real. My point about getting as much sleep is sleeping when the baby sleeps. I will tell you that often moms will say, well, I feel like I should be doing organizing things or I should be doing tasks or I should take care of something else while the baby is sleeping. The first 3 months, it is absolutely critical. Sleep when your baby is sleeping. Sleep when your baby is sleeping and safe. That matters. Asking for help from your partner, your family, your friends, being specific about what you need. It's one thing to say, I need help. It's another to say, I need more diapers, or I need groceries, or I need some crackers to eat in between these feedings, or letting someone know what you need, being as specific as possible. Again, back to the community aspect. We're not meant to do this alone. We are not. Taking time for yourself, I recognize that that looks very different after we have a baby, especially in the first few months. That might mean 15 minutes to yourself when someone comes to watch the baby, and you literally step outside on your front step and you feel the sun on your face. That's still time for yourself. I often refer to these moments for all of the women I work with as micro moments. What are the micro moments that you can include throughout your day? Knowing that those micro moments will turn into more macro moments as time passes. But that matters. Perhaps your day looks like that it's a couple of 5 minute moments when you step out on the front porch or the front step and you just breathe. You remind yourself that you're still you, even though you've adopted this new role. Connecting with other new parents is so significant. I cannot stress that enough. When we are feeling the most alone is when it's most helpful. And support groups or parenting groups or mother groups, whether you want to do it virtually, whether you want to do it in person, there are endless resources that exist, particularly in our community. And from an online community, I can tell you that Postpartum Support International has several groups for different categories. In fact, there are right now, and I know Abigail, when we spoke, I had mentioned it was over 40. It's out now over 50 groups that Postpartum Support International offers. Different categories, different times of the day, multiple times a week. Uh, Groups for dads, group for military family, groups for those who are within the LGBTQ plus community, groups for moms and parents who are parenting individually. So please, please, groups for moms who are expecting. Again, I recognize these are virtual and many of us would like to be in person. And those do exist as well. There are several, I know, mom groups within the Tallahassee Big Bend area. I believe at last count there were 5 or 6. So if anyone has questions and would like to know about those, please let me know. I do have a slide further in the presentation, but I do facilitate an in-person support group for moms, regardless of where they are on their parenting journey. And that is held on the first and third Thursdays. And I believe there's a slide for that, so I won't belabor that point. eating when you can and moving your body. I don't mean full on exercise and returning to a regimen that you had prior to the delivery of your little one or little ones, but moving your body. Uh, I've shared in the past that there were times that I would literally need to just walk. So I would put my son when he was an infant in the stroller and walk in our neighborhood. He was with me, but I needed to have that time where I was moving my body. We know that movement heals. So um, just throwing that out there for the moms and partners. I'm shifting now from the baby blues to what is more in line with depression, perinatal depression, what we've known as postpartum depression. A statement that I hear often from moms and partners is, I don't feel like myself and something is off. The image that I have there, and I want to give due credit to Karen Kleiman. Karen Kleiman, I would consider her one of the mothers of perinatal health, maternal mental health. And she's done an excellent job. And I believe that she was maybe even around before Postpartum Support International. Her books are excellent resources as well. So, this image, I give her credit. And another mom is asking a mom, how are you feeling? And she believes that her immediate response should be fine. But what's really going on in her head, if she's experiencing perinatal depression or perinatal anxiety, are many of these statements. And the one at the bottom resonates with me the most, and one that I've heard multiple times from moms is, I feel like I can't breathe. I'm going to let that sit for a moment. I feel like I can't breathe. I'm terrified. I love my baby. However, I don't know what I'm doing. And it's repetitive and there's a lot of rumination. This is when we know we're shifting more beyond the baby blues. And what we know, again, from studies and much research over the last 20, 25 years, is that if it's been 2 weeks or more, that's when we want to reach out for some help. And that's okay to do. There is so much more understanding and acceptance and knowledge amongst medical professionals and mental health professionals and society at large. It's okay. It's okay if it's been that past 2 weeks and you're starting to feel as if something is off. 1 out of 5 women may very well experience anxiety or depression during this perinatal period. Again, that is also just to stress that during pregnancy and after pregnancy. Very important to know that you can experience this during pregnancy. During pregnancy. What is perinatal depression? What does it look like from symptoms? And I have some, when I say what it looks like, I have another slide that I'll touch on that with this actually comments that will help elaborate on such. We know that 1 in 5 women experience this. Another important point to note that many are not aware of is that 1 in 10 partners will experience perinatal depression. That's been recent findings, last 5 or 6 years. That's important. So knowing that our partners can also experience these symptoms, as you see here on the screen, appetite. Oftentimes moms will just completely stop eating. Um, we know that there is a sleep disturbance after we have a baby. However, this type of sleep disturbance is excessive. Um, not wanting to get up, not wanting to engage with the self, not wanting to care for oneself, a loss of interest or joy in things that once brought you joy. That's a huge indicator. If you hear a mom saying that I just don't have any, I don't feel like I want to do anything that I once loved. I don't enjoy these hobbies. I don't want to spend time with my friends. Um, those are indicators that a mom and or her partner may be experiencing may be experiencing some perinatal depression. The last point, the possible thoughts of harming the baby or yourself, that would fall into the category of severe depression. And again, sharing that with someone, letting someone know that I'm having these intrusive thoughts. And an intrusive thought is a thought that doesn't really register with you. It's not something that you experienced before, and it's causing you great distress. Um, these images can, of course, lead to perinatal anxiety as well. So again, thoughts of harming oneself or the baby, those are significant. There's a way through it. There's definitely a way through it. What do these symptoms look like? This I get asked all the time. And so I thought by adding a few quotes and statements, this would further the understanding. Overwhelmed. What does overwhelmed mean? I feel like I can't handle or cope with all of this, meaning all of motherhood, all of being myself, struggling to care for oneself or the baby. Yes, it's difficult to get those showers in and eat after we've had a baby, but this is different. This is a purposeful intention saying that I have no desire to even care about myself, to even want to eat, want to shower. The isolation, the social isolation, excuse me, when a mom or a partner says, I just don't enjoy spending any time with my friends or family anymore, purposeful self isolation is another indicator of what perinatal depression would look like. We know study after study after study has shown us that often anxiety can coexist with perinatal depression. They seem to be partners, not all the time, but often. And increases somatically. And what I mean by that is an increase in headaches, back pain, stomach issues. Again, very likely could be a contributing factor to perinatal depression. The irritability upticks significantly. I feel like I'm losing control of all of my emotions, not just the fluttering of emotions, but losing control of everything. And I'm not interested in taking care of myself. The last box that I have to the far right, I wish, or on the right on my side, I should say, I wish I could disappear. I wish I could just leave. What would happen if I just, you know, drove my car and just kept driving? I could give you hundreds of examples. These are just a few of what perinatal depression can look like. Again, there is a way through it. There is definitely a way through it. There are so many wonderful providers in our community. In fact, there are 8 at last count, if not more now, that have been trained by Postpartum Support International, which is the gold standard for training for perinatal mood and anxiety disorders. And there are 8 of us, and I would love to see that number double and triple. If you're interested as a new mom or an expectant mom or a partner or a provider yourself or a community advocate, please go to Postpartum Support International and look up their directory, and you can find who those providers are that do have extensive training and understand what it's like for moms and partners. Looking at the risk factors, I have 2 slides for this, and there's even more, but I wanted to keep it as short as I could. Risk factors. Does the individual have a history of anxiety or depression prior to pregnancy or during pregnancy? Is there a family history of that? Premenstrual dysphoric disorder. Is that something that an individual is diagnosed with prior to? That can be a contributing factor, adding to the risk. Lack of family or social support, an unplanned or an unwanted pregnancy as well. Has she experienced sexual or physical abuse? Another key risk factor. Relationship struggles. If an individual knows that they are going to be parenting independently, another risk factor. And I should note that these risk factors can certainly be found through Postpartum Support International, and there's several bodies of research that support these as well. They're well known, but I thought it was important to share them. Something that we've learned more so in the last 10 years is complications in pregnancy. If a mom has had a difficult or a traumatic pregnancy, her risk increases. Struggles with breastfeeding tremendously as well. Mothers of multiples, mothers of infants who were in the NICU, much like myself, that can also be a contributing factor to a higher risk of experiencing perinatal depression, perinatal anxiety. There are some biological things, components as well, such as a thyroid imbalance, having the thyroid checked, diabetes, type 1 or type 2. And again, we know that IPV or intimate partner violence can increase the risk. I did not have a slide for this next point, and I made notes to the side just to make sure that I bring it up. I think it's absolutely critical. We know that other risk factors belonging to high stress parenting groups, and I'm not sure if you've heard that terminology before, but I'll share it, that these groups may be at greater risk for experiencing perinatal depression and perinatal anxiety. Those military families, as I noted before, teen parents, those who are in the teen years that are experiencing pregnancy, parents of multiples, as I noted, as well, parenting independently, queer and trans families as well, up to 6 times more likely to experience perinatal mood and anxiety disorders. Pregnancy loss. If a mom has had a loss, again, the risk factor, that's one of those risk factors as well. And those survivors of a trauma. So the reason I'm sharing these is if you are working with moms on a daily basis, or you yourself are a mom, knowing what these risk factors are and being able to talk about it, either during pregnancy or post-pregnancy, asking those open-ended questions and learning more about the mom, learning more about the circles within their life, learning about their partners and their life experiences. We know that our life experiences matter, and they matter when it comes to pregnancy and maternal mental health. I thought it was really important to mention those. I know it's a lot of words, but again, want to be as inclusive as possible. Shifting to perinatal anxiety, as I mentioned, we know that perinatal anxiety and depression can go hand in hand. It's the constant worry, the constant rumination, feeling dread. And I define dread as something bad is going to happen. I feel like I'm going to drop my baby. I don't want to drop my baby, but I feel like I'm going to drop my baby. I feel like my baby's going to fall out of the car. I mean, these are just a few of the hundreds of examples I've heard. Racing thoughts, not being able to control. The thoughts just are constant. The mind can't slow down. Inability to sit still. So again, if you're working with a mom, pay attention, right, to their words and as well as their actions. Are they having difficulty? Are their legs shaking? Are they moving their hands a lot? Are they telling you that they have a disturbance of sleep? Are they eating? Oftentimes we forget to ask ourselves and those we work with, are you eating? Are you fueling your body? Physical symptoms. I've heard moms talk about dizziness, feeling as if the room is spinning, that their heart feels as if it's racing or it's going to come out of their body. Anger and irritability. We're learning more about postpartum rage. There are several excellent podcasts with providers. If anyone would like those, I can share those after the our time together. Again, rage very much falls in line with anxiety. Rage at the core of that typically is that our needs are not being met. We become resentful, and the resentment turns into rage. And so that can feel very disconcerting to a woman, especially one who has never experienced that before. We talk a lot about rage in the support group that I do, and letting them know that we all have anger. It's one of the 82, 84 emotions that have been defined and described for us. And that rage, when we get to that place, being able to mitigate that and what are healthy ways to do so. Often it's having our needs met, need or needs met, singular or plural. Risk factors are very similar to those of depression, perinatal depression. Again, lack of partner support, low self-esteem, relationship challenges, a thyroid imbalance. Again, that's critical to have that checked. And we are our best advocates, checking with our providers if we need to have those tests and that blood work done, that is okay to ask. I was just talking about that with my students yesterday in the class I was teaching. We are our best advocates. And oftentimes, if we're working with moms, they may say, well, what does that mean to advocate for myself? Helping them with the questions, putting those questions down on paper or on their phone so that they know what to ask if they're experiencing these symptoms that we've mentioned. So the stigma surrounding depression and anxiety in the perinatal period, again, Many moms and partners that I've spoken with, they have this fear that they're going to be labeled as bad moms if they acknowledge the struggles. But a struggle shared is one that where we can support one another. I would guarantee that if you asked a mom walking down the street if she struggled and she was honest, she would say, yes, it's been a really rough day or a rough week. I just feel like I can't keep up with all of the things that I'm doing. And knowing that she is not alone and being able to acknowledge and validate that is something that partners can do for their moms, that we as community advocates can do for moms when we're spending time with them. And we can also do it for ourselves. I've often said, what is the mantra that you want to give yourself during this new mom phase for yourself? I'm doing the best I can. The next hour is what I'm going to tackle first, and I'm doing the best that I can. Guilt and shame are huge. I still believe, and not just me, what I believe, but what I hear, what I see from moms, what I know from studies is that, society tells us that motherhood should be happy all the time, making it really hard to admit when it's not. It's an and, it's not an or. There are moments of joy and there are moments of struggle. I enjoy this part and I really don't like this part. Think about that. If you don't remember anything from this presentation, think about it's an and instead of an or. The stigma is reduced when we have dialogue, and the dialogue has expanded exponentially in the last 20 years. It's so easy to do a search and find, as I said, an excellent podcast, an excellent online group. I mean, we could hop on at any minute of the day and step into conversation. I encourage you to do that as a new mom, as an expectant mom, as a partner, as someone supporting. It helps to reduce the stigma. I've often said that one of my missions is that a day of dialogue, helping to reduce that stigma, would be huge. It's on my to-do list. It will happen once I can learn how to split myself into 2 or 3 people, as many of us like to do. Just a moment of levity there, but the bottom line is the more we talk about it, the less stigma we have. I did a little bit more with statements, expanding on the societal expectations surrounding perinatal depression. Um, Women often don't disclose things because they think they're supposed to be super moms and happy. The social media posts, again, back to that, limit your time, remove. What's wrong with me is a question I hear often. And my response is there's nothing wrong with you. You are adapting and adjusting to this new role. Secrecy within family and community, practicing cultural humility, understanding that each family and each culture is different and how they approach motherhood is important. Helping to talk about it with those you feel safe. Sometimes it might not be family, and that's okay. The bottom statement, I probably should have bolded, but I'm going to emphasize it. If I tell anyone what I'm thinking and feeling, they're going to take my baby away. No, if you tell someone what you're feeling, they can help you. Let's reduce that fear. Let's eliminate that fear. Let's make it normal that we can talk openly about the struggles that we're having so that we don't suffer in silence. These are the common statements. Well, it's about 10, but there are many, many more. I thought this would be helpful for those of us supporting moms and those of us who are in that space in our lives is something is not right is the one at the bottom. I won't read all of these to you, but these are very common. The alone, I still, it's been more than 2 months. This is a key one, I've never struggled before with depression or anxiety that I'm aware of. So I can't be experiencing that now. Constantly worried. Panic attacks are quite common with perinatal anxiety. And knowing what the difference between anxiety and panic is. A panic attack often comes on suddenly. We don't have any preparation for it. It feels as if we're going to die. That's how women describe it. And men, I feel like I can't breathe. And it came on all of a sudden. I had no warning. And we have a somatic experience in regards to that. Anxiety, we typically can feel that rising. And I know you can't see the lower part of me with my hand, but I often describe it as green, orange, and red when it comes to anxiety. Green is it's right at my belly button. Green, I'm calm, we're measured, I'm fully present. I can respond to situations that are difficult. I'm at a green. Oranges, I feel it rising a little bit. It's right here. I'm starting to feel pressure in my chest. I feel like that I'm overheated. My heart is racing. That's an orange, right? That's a flag for an orange that my anxiety is starting to increase. And then red. Red is when I'm at capacity. Red is when I can't think. My emotions are all over the place, quite elevated. And so anxiety is often can be gradual, where panic is very instantaneous, panic attack. So, how do we determine between perinatal depression and baby blues? These three things can help us determine. Again, the duration. If I'm just starting to experience some of these symptoms, I'm a few days out, then let me check in and see with the other components or the other categories, the timing. Is it post 2 weeks? When did this occur? Is it severe? And what I mean by severity intensity is the frequency and duration, right? Am I crying multiple times a day? Are my emotions rampant? Do I have such an extreme with my emotions multiple times a day? Is it more intense than it has been in the past? Those three components can help us determine, am I in baby blues or am I stepping into perinatal depression? Very, very helpful. I'd say severity and intensity and the timing are key. When again, for us as a mom, an expectant mom, or those who are serving moms. Um, Adding on to that, and I won't go into great detail, there are several screening scales that providers can use to help a mom determine if she's experiencing perinatal depression, perinatal anxiety, perinatal OCD, PTSD, etc. I'm just noting the Edinburgh Postnatal Depression Scale. It is one of the most well used and well vetted of all. It's very brief. And the reason I share this is, again, back to advocacy, advocating for yourself. If you are pregnant, you can certainly bring up and experiencing some symptoms that you're unsure of. Talk with your provider, talk with the nurse practitioner or your physician and say, I think it would be helpful for me to get a clearer picture. The Edinburgh Postnatal Depression Scale, 10 questions, can be done in 5 minutes. A mom can do this themselves, and it should be administered, obviously, by a healthcare professional. It's a yes or no format, and by using that assessment, it can determine, are you experiencing perinatal depression? In the beginning, when this was created, it was mostly used in the postpartum period. However, now we know providers are able to use this and get a good gauge to determine if someone is experiencing these symptoms. So again, you have the right as a mom, as a partner to say, I've heard there's a scale that can help me learn a little bit more about myself. It's okay to ask for that. It is not universally mandated and required for that to be used during pregnancy or post-pregnancy. But the good news is more and more providers in the wonderful state of Florida are doing so. So kudos to you. Kudos to you. I gave an entire screen for this. It's something that I literally was jumping up and down and screaming about with joy 2.5 years ago, the National Maternal Mental Health Line. Key points, culturally sensitive, 24 hours a day. This is staffed. You can call any time, text any time. Please, please share this resource with those you work with. Keep it if you're a mom and you're not sure. what it might be like for you with pregnancy or post-pregnancy, you can call and they'll guide you, they'll support you. And to know that this funding finally went through 2.5 years ago and we have this is huge. My hope is that will continue. It's helped and saved so many moms. Um, this is a very busy slide, and if you'd like to keep it, you can. I've mentioned Postpartum Support International, and I listed them several times here. General information for those needing information, the general public, moms, parents, partners, but also for providers, those of us who want to expand our knowledge, expand our understanding of maternal mental health. This is the gold standard. Their trainings are excellent. I myself am trained by Postpartum Support International and quite proud of it. So for those of you who are interested, I encourage you to explore. I also included their chats. This is something recent that they've added in the last year and a half, 2 years. You can actually chat and schedule a chat with a trained, licensed mental health provider. These chats, they have them for dads, they have them for moms. The link is here on this screen, and I encourage you to check those out. You schedule a time with a provider for free, no charge. I want to say that again, no charge. And again, back to their support groups that they have, the 50+ support groups that they offer online, those are offered free of charge every week by trained and vetted providers. I also included the Postpartum Stress Center, excuse me, and here in our own wonderful state of Florida, the Florida Maternal Mental Health Collaborative. Their website is currently under construction. I was checking it out a few days ago. Dr. Heather Flynn at the FSU College of Medicine and several others worked very hard to form this collaborative, this coalition. If you would like to become a member, be added as a provider, gain information, it is full of resources. I encourage you to engage. Perhaps you want to serve on the committee, get involved. As a mom to be, as a provider, as an advocate. If you are interested in advocacy efforts, I strongly encourage, and you want to know what's going on around the entire country, including your own state, the Policy Center for Maternal Mental Health. They are the leader in our country. So again, if you want to know what bills are being passed, what bills are being proposed, please, please, Marseille Society, the Perinatal Mental Health Alliance for People of Color, and Black Mamas Matter, two excellent organizations. Again, there's so many more organizations and resources to share, but I wanted to include those for you. Those are on a much broader scale. Some of them have local support as well. Speaking of local support, as I noted before, the only in-person group that I know of right now still, which I would love to see that change, and that is another goal of mine, is the Circle of Support. The first and third Thursdays. It is held at a faith-based institution. However, it's very important to share that it is not based in faith. It is open to all moms. All moms are welcome. This particular facility is a huge proponent of being a community facility, and they have offered the space. It was founded in 2020. It is free of charge and also free childcare for 6 months and older babies by trained healthcare providers. We just ask that registration be completed so we know how many moms are coming. I do limit it to no more than 12 so that we can certainly have that interpersonal interaction. And again, the link is there. If you have questions after, feel free to reach out to me. My email is included, I think, on the last slide. I put this here because it's hands supporting hands and hearts. Support for moms and families matter. Moms are at the center. That I believe for sure. Everyone is important, but if a mom is well taken care of and loved and knows that she's not alone, everything else seems to fall into place. It might not be perfect because nothing is perfect. However, questions. My email is there. I'm not sure of our time. I can't see the clock, but
You're doing fabulous. I think I know personally I would love a list of resources, so I'm going to follow up with you on that,
Okay,
specifically books
great.
and podcasts.
Absolutely. Yeah. I can think of a lot of them right off the top of my head. Mom in Mind, but anyway, I won't ramble, but there's several. Yes.
Does anybody have any questions for Danielle?
If I may I just show this book is excellent. It's called Beyond the Blues, A Guide to Understanding and Treating Perinatal Depression. Um, I believe I included on many of my slides as a resource. I have oodles of books. I just find that this one, as you can see, all the tabs it's a very easy read. And what I mean by easy read, I've handed it out to many grandparents, aunts, uncles of moms, women in their lives who are struggling. And it's written in such a way that it's very easy to digest. There are several other excellent books that I'm happy to share if anyone would like to reach out to me. But I always share this one when I do groups and when I give presentations. It's very digestible for all, no matter where we are, if we're supporting or we need the support. So,
I don't have a question, but thank you so much, Miss Danielle, for presenting this. I learned so much and took so many notes to take back to the doulas, and I would love to connect with you and maybe you can share this with the doulas as well.
oh, I would welcome it. Please know that one of my missions is to continue to talk as often as I can and share from a very humble, loving way how much I can help. Please, please let me know what I can do. I mean that. I don't just say that. I mean it.
Danielle, you just opened up a box. We're going to be bringing you into a lot more conversation that we have here at the coalition as we are supporting women in this space.
Great. I welcome it. And I know this was just really on the surface. There's so much more. We can go so much deeper. And in all honesty, it was really hard for me because I found myself hours and hours thinking, no, I need to narrow it down. There's just so much. And I'm pretty sure I'll spend the rest of my life ensuring that I share from a humble way. Again, partage, share.
Amanda?
I just want to say thank you so much for including those motherhood myths in this presentation. I thought it was really important for hearing some of that messaging. I know even for me personally, even though I've learned about some of the myths before, still hearing them on a continued basis really is validating for me as a mother. So I think it is important that we continue to spread that message. Thank you.
Absolutely. Thank you so much. I'm glad that those landed on you and resonated with you, Amanda. I appreciate your comment.
All right, well, if there's any more questions, I dropped my email in the chat. So if there is anything that you think of afterwards, please feel free to reach out to me. And obviously to Danielle as well. We can circle back and I'll definitely be posting those the resources as well when I send out the link to the recording for everybody. So we'll kind of collaborate on that and I'll also share on social media. So make sure you're following us at the coalition. I really appreciate everybody's time. And Danielle, thank you so much. I can see in everybody's faces how valuable this was. And we really appreciate your time and expertise. It's bar none. So thank you so much.
That's so kind of you. Thank you for allowing me to share space with you. It was a gift.
Mhm. Have a fabulous weekend, everybody. Thank you so much.
Goodbye, everyone. Take care of yourselves.